Hello, welcome to my channel. Welcome to part 2 of urinary elimination. The use of indwelling catheter can lead to loss in bladder tone. If the doctor orders a urine CNS from a Foley catheter, you will clamp your Foley catheter. Wait few minutes, then with sterile techniques, you will insert a sterile needle into the port, withdraw your urine, place your urine in a sterile container, then unclamp your Foley tubing, preventing kinks. When a Foley catheter is inserted into the vagina, when you are inserting a Foley catheter, have a second nurse assist you. You will insert a second Foley catheter above the first catheter into the urethra. You will inflate with 10 cc of sterile water. Use your stat lock to secure your catheter, prevents kinking. You will take out the first catheter out of the vagina. This will be done with sterile techniques. If doctor orders Foley catheter to be discontinued on a fresh post-op patient early in the morning, it's usually done early in the morning, you will assess your patients. Your patient should void 8 hours after removing a Foley catheter. Have this patient get out of bed, ambulate the room, ambulate the hallways. And the patient would have been NPO at midnight. If the patient has resumed first a clear liquid diet, encourage fluid intake. If your patient is unable to void after 8 hours, notify your doctor. If patient is unable to void after 8 hours, the doctor will order a bladder scanner, which is a portable machine we use at the bedside to check the residual of urine in the bladder. Usually, if it's less than 200, the doctor will say, encourage ambulation, encourage fluids, call me back in 1 hour. If after 1 hour you you'll use your bladder scan and recheck the bladder. If the bladder is greater than 250 cc, you notify the doctor. The doctor will order an in and out catheter, which is also called an intermittent catheter. Some paraplegics, they use intermittent or in and out catheter at home to remove fluids, to remove urine. If doctor orders a CBI is a continuous bladder irrigation. This is usually done after prostate surgeries. The irrigation of the catheter, this three-way catheter, is done by hand using sterile normal saline. When patients have a CBI, bladder irrigation going, we will assess, very important, the patient's vital signs as ordered by the doctor and PRN. Patients may experience cramping of the abdomen, abdominal distension, abdominal pain. Monitor whether you need to increase the flow, or measure, assess whether you need to decrease the flow. Monitor normal saline intake. Monitor output from the catheter. Urine output is determined for patients using a CBI by subtracting the total amount of normal saline intake subtracted from the output. Whatever you get after you subtract the intake from the output, that is the total of your urine output. Please do your documentation, because usually doctors are looking in on the intake and output for these patients with CBI, and this delegation should be to a registered nurse, not a new nurse, not an agency nurse, if you're not familiar with this. Signs and symptoms of UTI: confusion, falling, frequency, urgency, foul-smelling urine, cloudy urine, include increased WBCs, blood in urine, low abdominal cramping. UTI is usually found in females because of the short distance from the anus to the urethral opening. Please wipe from front to back routinely and PRN. UTI for these patients will encourage them to drink cranberry juice, will encourage them to eat blueberries. Patients with UTI, we should limit caffeine at bedtime. Limit fluids 2 to 4 hours before bedtime. Patients should be drinking at least 2,000 cc's a day. Patients with retention, these patients have enlarged prostates, vaginal prolapse. Patients with retention has an accumulation of urine, inability to empty their bladder. Patients with hesitancy, patients with enlarged prostate, hesitancy caused by patient with anxiety, urethral edema. Dysuria is painful urination. Patients with infections or inflammation, vaginitis, prostatitis in men. Functional incontinence. Patients try to go to the bathroom to urinate, but by the time they're getting ready to pull their pants down, they're already gone. They cannot pull their pants down quickly enough. Maturation is also known as urination. It reflects urine from the bladder into the ureters. Total urinary incontinence. Urine comes without any warning. Enuresis is involuntary urination in children. It's called bedwetting during the nights. Stress incontinence is dribbling or leaking during laughing, coughing, sneezing, pregnancy, after childbirth. Oliguria is less than 400 cc a day. Nocturia, frequent urination during the night. Limit caffeine before bedtime. Limit fluids 2 to 4 hours before bed. Overflow incontinence is involuntary. Bladder becomes overly full. Patient feels no urge to void urine. Polyuria, patient is voiding greater than 3 liters a day. We are looking at our diabetic patients here. Patients have excessive frequent urination. greater than 3 liters a day, and urea less than 100 cc a day to no urine a day. We're looking at our dialysis patients. Patients who are on dialysis, do not give them continuous IV fluids. If there's an order for continuous IV fluids, please communicate with the doctor. They can have IV antibiotics routinely as ordered by the doctor. Patients who goes to dialysis monitor their blood pressure. Patients with a urostomy. This is an ostomy. It is kept outside of the abdomen. Stoma should be beefy red. Beefy red. This is normal stoma. If the stoma is gray or blue, this indicates ischemia. This indicates compromised circulation. Notify your doctor. Kegel exercises tightens the pelvic floor. Patients with stress incontinence. Patients after childbirth. Polynephritis. These patients have UTI, urinary tract infection. Signs and symptoms: elevated temp, elevated WBCs, flank pain, abdominal pain or tenderness. The doctor will order a UA or CNS to determine pyelonephritis. Doctors orders UA and CNS labs, urine specimens to determine the correct antibiotics to use for a specific bacteria. IVP, intravenous pyelogram. These patients are supposed to be NPO at midnight, nothing to eat. They can have mouth care. Do not swallow any water. Patients going for IVP, patients should not be allergic to iodine.